Hi everyone, welcome back to Dr.M, the inner medicine. See, in part 1 online gaming, we saw what is online gaming, what are the complications of it, how addictive it is for our children, and we saw whether it is good or bad. Now, in part 2, this video, we will see when compared to alcohol and smoking, how it is more addictive than it, and we will also see the scenario in developed versus developing countries with a case example. So now let's compare it with other addictions like alcohol and smoking. Even a 5-year-old child gets addicted to this PUBG or Free Fire or other online games. Whereas other addictions like alcohol and smoking develop only in a later age, that is adult age. Number 2, tolerance. Increasing amount of the substance is required to produce the same kick in the brain. For example, initially a single beer can give a kick, but later on, after years together, you need a full bottle of whiskey or brandy to give that same kick in the brain. So it takes many years to develop tolerance in alcohol and smoking. But in these online games, it develops instantaneously on day one. You can see children playing for 10 hours or 12 hours on day one itself. Social taboo and stigma is high in case of other addictions. But there is no stigma in playing online games. Children play right royally in front of their parents. Due to their ignorance, parents encourage this online gaming by gifting their children with iPad, mobile phones, and higher digital devices. For any addiction like tobacco or alcohol, the substance must be easily available, accessible, and affordable. For tobacco and alcohol, accessibility is legally restricted by government and alcohol is not available 24/7. Governments also impose high excise duty and VAT tax of more than 200% on alcohol and tobacco to wean people off bad habits. So affordability is an issue in case of other addictive substances, whereas a smartphone or iPad is always there in our children's hands and it is accessible easily. Moreover, net connection is there 24/7 and it is very easily affordable. The only warning sign is the game which states that you have been playing the game for too long, you can take rest now. But even this message can be disabled by adjusting the game management system. Therefore, we understand that online gaming is more addictive than alcohol or smoking. Now, comparing with developed countries, how do they tackle this online gaming addiction? Western children are forced to become independent by either working part-time or full-time at a very young age, and nothing is available free of cost for them. Whereas our Indian children continue to be dependent on parents even after marriage. So, as Indian parents, we decide everything for our children. But at the same time, we don't have enough knowledge and awareness about this online gaming addiction. Without knowing the life-ruining complications of these addictive games, we allow our children to get addicted to the most advanced game scam by providing them easy access to smartphones and internet free of cost. So, an Indian parent with their child playing an addictive online game is a very difficult and mutually destroying combo. Dear parents, either change your mindset and throw your children out of your house when they reach 14 years of age, or have a control in their online phone usage. If you are not able to set limits for the time spent online, then you can seek help from a professional regarding parenting tips to control their game usage. Online games are highly addictive and highly advanced that are unfit for our current generation. Even developed countries are now struggling to control this addiction. However, parents in the developed countries correct their children's behavior by seeking professional help. There are several internet de-addiction centers in US, UK and other developed countries where pediatricians and psychiatrists conjointly work together to change this addictive behavior by setting time limits and planning and behavioral interventions. Many internet de-addiction centers have been opened in Indian cities also for treating this online gaming addictions. For example, Delhi got the first internet de-addiction center in 2014. Kerala in 2018 shut Service for Healthy Use of Technology Clinic in IMHANS in 2019. And recently, in December 2021, in Government Omandurar Medical College Hospital in Chennai, an internet de-addiction center was opened. And for the past 6 months, it has catered many people. This center in Omandurar has treated more boys than girls since its inauguration. So, This center has a pediatrician, psychiatrist, psychologists, social workers, staff nurses, and a team to assess and help children to come out of this addiction. Pediatrician help is necessary to treat the medical complications due to poor food intake and prolonged gameplay. Now, a case scenario for your better understanding. Recently, a 8-year-old boy was brought by his mother with complaints of abnormal hand movements as if playing a video game. The boy had initially started playing Free Fire game during the online classes and later got addicted to it. So he started staying awake until 4 a.m. to play video games. Gradually, he lost interest in studies and started disobeying parents, and he refused to go to school. During assessment, he had poor eye contact with deterioration in personal hygiene, and he spoke in single words to us with very late reaction time. He also had dehydration and nutritional deficiencies, which was treated by Dr. Sarojini, pediatrician. He started to sleep only with sleeping pills. After 2 weeks of sleeping pills, gradually his hand movements started to come down. His mother brought him to the clinic every week regularly for behavior therapy sessions, and his family, the entire family cooperated, and they followed the techniques like limit setting and contingency management, like restricting the phone usage to 1 hour per day and at a time 20 minutes per session, and that too only for protective purposes. He gradually got out of this gaming addiction, and now he is back to school. In our country, lack of awareness and stigma regarding mental health prevents parents from seeking professional help. Many of us don't even know that we, the psychiatrists, treat gaming addiction. All children are using iPad, tablets, and all of them are playing online games, but still our people don't believe and trust psychiatry or inner medicine. Parents, please wake up against stigma and seek help if required for your children's sake. As I had said in Dr.M trailer video, knowing and understanding your problem is the first step in getting rid of it. Dear pediatricians, beware of internet gaming addiction, and your simple advice to children to stop playing online games really works. You are the first point of contact, and if you find that gaming addiction is severe, please do refer the family to psychiatrists for further treatment. Teamwork is very essential to save a child from the clutches of gaming addiction. So far, combining part 1 and part 2, we saw about online game, complications of it, how it makes our children addicted, how it is more addictive when compared to alcohol and smoking, addiction scenario in developed versus developing countries, and how to overcome it and seek help with a case scenario. In the next video, part 3, online gaming, we will see about the barriers to treatment and triggering factors for relapse or re-addiction. Until then, it's bye from Dr. M, the Inner Medicine. See you soon. Please do like, share and subscribe to our channel. Thank you.